You know, in God we trust, all those must have data. We'd like things to be outcome-driven, evidence-based, and I think delivery of healthcare in the future, like in other industries, has to be evidence-based and outcome-driven and centered around our patients for value. So I think data drives it all. Unfortunately, some of the first generation EHRs are where data goes to die, as are monitors. So you got to be able to get that data out in a usable way. So our company, like a lot of other companies that are thinking this direction, are building our own enterprise data warehouse from which we can report. Traditionally, EHRs, you have to report through their company. It's, you know, for example, I won't pick on any one, but if I want to report from the EHR where I practice, I have to go to that company's report writers, and they'll think about it for 6 months or so, or maybe give me a turnaround, after which I've kind of lost track of what my question was. So we want to be able, as physicians, report a little faster turnaround. So the only way is to have that data in a way that we can put it on our own data warehouse and report off of it. So there has to be interoperability there of some, either we got to build it or it's got to be provided by the EHR. And I'll give a shout out to a company that's a non-for-profit that's centered in Nashville. It's called the Center for Medical Interoperability. And medical interoperability is a whole other subject we could talk about for a while, but it's been tried a number of times, and all the previous iterations have been proprietary and for whatever reason haven't worked very well. But the idea with the center is to develop a platform, a common language to which EHRs, monitoring companies, any product that generates healthcare data can engineer to a common platform so that we can interchange information, or at least the raw data, in a way that doesn't require interfaces. When you buy a new printer for your computer, you don't have to worry about the interface, right? They give you a driver that defines that. So the first level there will be to require EHRs, vendors of monitors, to give you a driver, if you will, so that you can interpret that data that's coming out and get it into your EDW. I think then we'll see a lot of competition based on analytics. It's kind of going that way already. But when we no longer have to compete based on proprietary data and building interfaces, then companies can start to compete based on analytics. Until that time, I'm forced to build my own analytics. And probably will still have that preference going forward. The turnaround time is just so much faster. If we want to affect things in real time, we've got to have reports very quickly.